So good afternoon, everybody. Thank you so much for your patience. We are a few minutes late, but I'm sure we will be able to catch up. Looking at the faces of everybody here, I have this impression that we can do anything. So catching up on the agenda is not an issue. Good afternoon, everybody. A warm welcome to the Changing the Story Collaboration and Solutions for Migrant Health session. My name is Khalid Ismail. I'm a gynecologist, currently working at Charles University in Prague. I'm also a member of the 4EU Plus Academic Council. The 4EU Plus is an EU alliance of 8 universities. The University of Geneva is one of them. I am going to preach for the converted now, but migration is often framed as a challenge. Yet, as we all know, it's a driver of diversity. It's a driver for innovation. Certainly, it's a driver for resilience. And it's the biggest driver for equality. The aim of this session is really to stimulate some reflections, a dialogue, maybe plant some seeds for future collaboration, hopefully in the field of migration and health. In this session, we have 3 sections. The first section you'll see 2 inspiring talks. So think of this as your appetizer. This will get the juices going for the main course. And the options for the main course are 3 roundtable discussions, one of them focusing on data and research, coordinated by Professor Carl Blanchet. Then there will be a roundtable about mental health. This will be coordinated by Dr. Javier Josiah. And then the third table will be about migrants as health actors. And this will be coordinated by Jessica Pragnier, and she is the head of the program. The roundtables are supposed to last about 45 minutes. If you're getting your teeth so much into the discussion, we might give you 5 minutes more, but hopefully 45 minutes. The roundtables will be at the back of the room. Just a word of caution: they are not round, and there are no tables, but they're still there for you. So I think without any further delay, it gives me a great pleasure to introduce our first speaker for today. Our first speaker, in addition to being a physician, Dr. Severoni is also a health economist, an epidemiologist, and health systems management specialist. He has over 24 years of experience as a technical advisor and senior international manager for governments, as well as multilateral organizations, NGOs, and foundations in East Africa, the Balkans, Central Asia, and Europe. Dr. Severoni is the director of the Department of Migration and Health at the World Health Organization. He has led the WHO's work on public health aspects of migration since 2011. Initially at the regional office for Europe, and then from 2022 at the global level. He is recognized for his commitment to health equity and inclusive health policies. Dr. Severino led the publication of the first WHO World Report on Health of Refugees and Migrants, emphasizing the importance of adapting health services to the specific needs of these populations. Dr. Severino, the floor is yours.
Good afternoon. Thank you, Professor Ismail. 2 nice presentations. Usually, I consider myself just a country doctor, which is really sometimes the idea of a doctor which inspires more of us to study medicine. Being strong linked to people in what we are doing, I think it's easy to build up the linkage or the path to develop interest on a complex topic like the health aspect of population movement. It is a challenge, indeed. There is a lot of stories, a lot of talking about the topic. The reality is that, and I see a very precise marking point or turning point, until 2018, the perception about migration was focusing on remittances, the positive impact of remittances, and development, and social development. Then some smart campaign advisor understood that the topic can be very, very impactful in terms of vote gaining if we're going to turn our fear and prejudice against people which are looking different from us and coming as a last. And to confirm what I'm saying, and this I share a number of times, if you have this evening 5 minutes when you go to rest at home, search for the last speech to the nation of Ronald Reagan, a very firm conservative president, and listen to what he was saying about migration, the added value, the positive impact, the regenerating strength of the country, and the reason for a country to be leader in the world. Now, this narrative is totally changed, is intoxicated by negative impact. Is this important? Is this relevant for public health particularly? Yes, it is, because the topic is not purely an health issue. The topic is shared across the boundary of different ministries, and in terms of government mandate, the mandate lay with a Ministry of Interior primarily in managing the migration. So for a time when I started to work in this area, speaking to the Ministry of Health about health and migration was sounding like I was encouraging the Ministry of Health to intrude into the terrain, the territory of Ministry of Interior. And Ministry of Interior, they were very territorial, saying, why do you want to get involved into that? So until, and I can tell you precisely, 2011, there was almost nil material, science, evidence, data in WHO, despite we had at the time a very impactful Health for All database. There was not a single indicator on this topic. And the topic in terms of public health was only touched upon when we were addressing humanitarian assistance, so displacement, and or addressing the issue of right to health, equity, gender issue. And this is very concerning also as a WHO staff, because this has been generating the perception that the topic is mostly a humanitarian issue, which is not. And when I say humanitarian issue, usually tend to look at the type of charity sentiment that we need to help these people in a unlucky situation, which is totally wrong, which is totally wrong. If you're talking about being present and timely present to a world which is changing rapidly, we need to accept that we are switching very fast from a middle-aged type of structure of our world where population demography is changing, where today I challenge any one of you, if you have kids, to tell me if you're in the classroom of your daughter or son, there is no a diverse nationality present in the room. And this requires the public health sector to be able to address, to understand, to identify and manage the public health implication related to that. And this story started only a few years ago, in 2011. Since there, we have seen growing in terms of policy frameworks. We have seen major changes, encouraging changes. As we speak, probably 1/3 of the countries around the world, they are having concrete commitment in changing their own health sector with the aim of including migrants and refugees, including in many cases irregular migrants, into the access to health sector. And the access remaining still the major challenge because it's linked to an economic discourse. Who's paying for the bills? But this remaining the main challenge the country need to face. What is not spoken about, that migration as a first of all is a positive investment for the society. Like health, we are telling that to do prevention and health promotion is an investment which is paid back in some time in the future in terms of reducing the cost of access to care and treatment. And the same is with migration. But still, the situation is very challenging. As I'm speaking with you at this moment, and I don't want to sound pessimistic, usually I'm very optimistic, neither unreasonably optimistic, but I try to be realistic, to be honest. Probably we are facing today one of the major challenge to the value which we use to build up the society we are living with, the multilateral system, which undermining the principle which has been guiding our way of working up to now. And I don't want to scare anybody. Probably the topic of migration will be one of the things which will be penalized as a first. So the risk is to step back because of the current geopolitical landscape, the switch towards nationalism and anti-globalization process will be making the border even more solid than what are now. And the attention is switching towards other area, funding switching towards other areas. And we see also within the United Nations where the health dimension of population movement is the one suffering the first cuts nowadays. So this is a moment where probably we need to stand the ground. We need to be very clear that the modeling, if any at this stage we can refer to, they are modeling telling us that we will have an increased demand in terms of equity, in terms of right to health, in terms of protecting the most vulnerable part of our population to accessing essential health services. And we need to think this now, and we need to resist now to make sure that this area stays embedded into the priority of the global health agenda, the regional health agenda, and national agenda at country level. I like to conclude with a positive note. When I started, there was not a single minister. Actually, let me tell you a short anecdote. When I first time spoke about this idea of establishing an health and migration program within WHO was the European Regional Committee. There was a Director General sitting where Khaled is sitting, and then all Ministry of Health. Director General was looking at me almost upset, not very encouraging face, and the Ministry of Health terrified because the topic was totally stranger to health sector. Today, we see a lot of champion countries. The last one I've been was South Africa, where despite the difficulties, despite they are still confronting with an important epidemic in terms of HIV and TB, the country decided that because of their own historical legacy, even irregular migrants, they need to be offered full access to services. The challenge is to build up the capacity to assist those countries to implement those ideas. Uganda, with 1.7 million refugees, has politically decided to offer to them an health insurance coverage. Colombia, with 1.5 million migrants from Venezuela, have been offering the health insurance card to all of them. And they're having access, either they are regular with a card or even irregularly traveling to the country to seek medical care. So those are signs that things are changing. At this stage, it's important to make sure that we are not reverting those changes, we are not losing the benefit of those changes. So I wish you a good discussion. I see that the agenda is very interesting, especially I'm very curious to hear about mental health, but also the other topic. So thank you very much for having me here, and I wish you a good discussion and conclusion of the meeting. Thank you, Khaled.
No, thank you so much. Thank you so much. Thank you so much, Dr. Severoni, for setting the scene, but also giving us lots of inspirations. It's really amazing that when we talk about good examples of things happening in the world, they are actually happening from the global south and coming to us rather than the other way around, I guess. For the sake of time, I'm going to move on. Otherwise, we would have reflected on what Dr. Severoni told us. But now I would like to invite Anna Dudchenko to the podium. Anna is a Ukrainian researcher who is now pursuing a doctorate degree on the intersection of mental health, migration, and health systems. Over the next 10 minutes, I will have the pleasure of interviewing Anna to understand a bit more about her expertise, experience, and expectations. Thank you so much for joining us, Anna. Right. So we've put a few questions for you here, Anna. Sorry to put you under the spotlight, literally. But first of all, can you tell us briefly about your background and what led you to Switzerland?
Thank you, Professor Ismail. And first, of course, I want to start with expressing my gratitude to you, to the organizers and speakers and facilitators of the session for creating this beautiful platform for like-minded people to exchange and collaborate. So my name is Anna Duchenko. Um, I'm Ukrainian public health expert, working around 7 years in health system tech in Ukraine. In February 2022, at the beginning of the full-scale invasion, my hometown of Irpin was occupied. My family was evacuated. Um, Shortly after that, I started to think, like many colleagues of mine, many people I know, how to continue the job that was very important for me in a safer environment. And I started contacting my colleagues worldwide to look for opportunities. And then I discovered the SNSF support program for Ukrainian scientists in Switzerland, which allowed me to continue my work at Swiss Tropical and Public Health Institute. And of course, I had to live in Ukraine with my small child. He was 4 at that moment. It was, yeah, a very tough experience because I had a lot of uncertainty in front of me. I had a lot of pain within me for leaving a big part of my family, for my hometown being occupied. But I was triggered not only by the feeling of and will for more safety, but I wanted to use my expertise to support the people in similar situation. I wanted to contribute to the host country, which was a great driver in me. Um, so after 3 years being with Swiss TPH, I shaped my research interest and I started my PhD on the intersection of migration, mental health, and health systems.
Wow. Thank you for this summary of something that is much more extensive than I can even imagine. Um, but if you don't mind, Anna, sharing with us, how did your personal experience as a migrant influence your work in mental health research?
Thank you. So of course, my experience of displacement helped me to understand very deeply and personally the experience of people in similar situation. Yeah, I guess a lot of us are migrants. It's pretty much a continuum. Yeah, so um, I don't see like being a migrant as a special labor for a person. So my PhD is centered on the access to mental health care in Canton of Basel City, Baselstadt. And I'm especially interested in people's perceptions and people's experiences. I'm very honored to be a part of the partnership between Swiss Tropical Public Health Institute, the Social Welfare Office in Baselstadt, and the University Psychiatry Clinic. Our project is aiming to explore the treatment gap for mental health care in the socially vulnerable migrant population. And also by this, we want to inform the design of the intervention increasing this access. And also part of another project represented here also by the co-PI Emma Clark, who is in the front row. Thank you for coming, Emma. So People Voice Survey is one of the first multi-country large-scale initiatives to explore the people's experiences and perceptions of the healthcare system. And in Switzerland, in this way, it has also like a special focus on migrants. So summing this up, I would say, like for me, this experience is both professional and deeply personal.
Uh, and now I want to ask you just to dig deep a little bit into this. What have you learned about the mental health needs of migrants through your community involvement in Basel?
Thank you. So overall, I would say that Basel has a very strong Ukrainian community. and also a broad network of local and non-governmental organizations supporting migrants. And as a refugee, as a researcher, I would say that I see great potential in strengthening the ways that people can access the support, but also contribute the skills to the support. And overall, like there is a lot of valuable services already in place. And by increasing the visibility, by increasing the connectivity between the public health structures, the support networks, and migrant-led initiatives, we can really help the people to navigate the system much better. And also with higher awareness and better collaboration, we can ensure that we not only make the best of what we have, but also we ensure that the care is reached by the people who need it the most.
Thank you very much for sharing this insight, actually, because obviously everybody is unique, but your experience is super unique, to be honest, and certainly gives you the ability to do such reflections. You now work at the intersection of research, support networks, and refugee communities. What potential do you see in this kind of collaboration?
Thank you. So first of all, I do believe that migrants and refugees can bring an invaluable value to science, to health systems, to society overall. In my experience, also the strong collaborations between academia, between migrant-led initiatives and the public health system, it can help creating the more sustainable and more impactful results. Like for example, the academics employ more often and often the participatory research, which involves the people with the lived experience from the planning of the research for stating the problem to the implementation and translation of the results. And it's a core value of our projects as well. So each of us has a unique perspective. And by working together, by working cross-sectional, we can really come to better and more sustainable solutions for migrant health.
Thank you, Anna. I'm going to finish off with really quite a big task in a way that you need to deliver in a very short period of time. So no pressure. But what message do you want to leave us with as we start moving to the roundtable discussions? Just something to trigger really our thoughts, maybe.
So all the topics we have today, the mental health, the research and data, and the migrant agencies, they are all very connected, and we cannot really isolate them artificially. And it's not enough anymore to work very effectively, but in silos. We need better data. We need integrated data for the decision making. We need a really strong and continuous cross-sectional collaboration, and we need to involve migrants' voices in every step. And I do believe strongly that today's session can create these networks, can create these commitments and the momentum to make it happen. And I really encourage everyone to reflect on their own role in this network and also to make a small but very personal commitment for his or himself today. And also talking on the broad context of displacement and mental health, I do believe that we could keep in mind in our heart my homeland, Ukraine, not only as a country enduring the effects of the unjustified aggression, but also as a partner to build together the more resilient global society, to share the knowledge about the resilience and recovery, and we have to work together for a better future. Thank you a lot.
Anna, thank you so much. I mean, I wish we really had more time, but I do hope actually our paths would cross again in the future in the form of a research collaboration or something. It would be an honor for me to be part of one of your programs or intersections. And thank you so much for sharing a glimpse about your personal and your professional life. I think everybody here will agree, Anna, you are the perfect ambassador for your country. You're the perfect ambassador for women and the perfect ambassador for researchers all over the world. And thank you again so much for joining us. And we look forward to your participation in well, you can participate in any of the tables if you want, but it'll be interesting to see which one you're going to participate in. Thank you very much, Anna. Thank you. So now we are going to move on to the round table discussions. We have 3 tables. Having listened to Anna's thoughts about the round tables, maybe you should imagine them like the circles of the Olympics, circles that intersect. So they're not isolated islands. So although for the purpose of what you're doing today, you will have to choose an island and stay on it, but try to interact with everybody else. As you already know, the 3 tables, one of them is about data and research. Carl Blanchet is going to coordinate this. Mental health, Dr. Javier is going to coordinate this, and migrants as health actors. Jessica is going to be your coordinator. There are quite a few co-animators who will be with you on the table just to get the discussions going and support the coordinators of the tables. Once we've finished this session, we're going to have a 15-minute wrap-up, 5 minutes for each table, just to share with us some of the thoughts that they have generated from the discussions. And also, I just want to make you aware that we have a collaboration board. So if you have a smartphone, I assume you do, then please scan this QR code and register on that, because this hopefully will be a digital platform of bringing thoughts and ideas and minds together so that we can really build something effective that would have far-reaching aims than just an hour and a half or 2 hours of discussion. So I will let you go to the tables and we'll meet again for the wrap-up, and then I'll give you some other pieces of information. I don't want to overwhelm you with information. Thank you so much. So it's lovely actually that that people want to continue talking to each other, and this is the whole idea of it. But if you don't mind me interrupting this, I'm sure very interesting and fruitful discussion, and just ask you to come back, because the plan is to hopefully finish this soon, to give you time to network more while you're having coffee and watching the photo gallery that are both in the foyer outside. So can we can I ask you if we can make a start, please? Thank you very much. Just a very quick reminder about the QR code on the screen, the collaboration board. Please do register so that people with similar interest can get connected. So this the amazing work, I'm sure, that has been happening over the past 45 minutes on the different roundtables is now really going to be summarized. And Again, reflecting on what Anna told us before, that the three topics are really very much related and intersect. I guess the wrapping up session will help in achieving that. It gives me a great pleasure to invite the coordinators of each table to present that. I've already introduced our coordinators before, but the first to the podium will be Professor Carl Blanchet, if you are happy to join us. Your task is an easy one. Just wrap up the 45 minutes in 5 minutes, please. Thank you very much.
Okay, excellent. It's well organized, as you can see. So I'm going to try to make justice to the beautiful ideas that have been shared with us, with Eve Jackson and myself. So our topic is about data and research, and we had three different themes. One of them is about quality, second one equity, and the third one is about narratives. And we had some fantastic contributions from many members. Today we are suffering in research because there's a lot of fragmentation of data. We have there are data a bit everywhere, but we have difficulty to make sense of it. And we have difficulty to link all the different data sets, national statistics, health data with other data coming from social services. And as well, of course, when we talk about migration, about the displacement of population, people are moving all the time, even within a country, to find the right safety nets, social networks, and services that are appropriate to their needs. One aspect is about related. So the first aspect, and I know Eve is very keen on this because it is a very important aspect, is that reducing the term migrant to simply migration would be a wrong use of our skills as researchers. Migrants are made of identities. They have different trajectories. They have specificities. They also have different aspirations of moving, of life, about the future. So the researcher, we have the responsibility to actually be granular in the way we describe and analyze their lives, their trajectories, and their needs. That's important. Instead of simply, in a very simplistic way, simply the migrants, and that's it. So there's no homogeneous group among migrants. They all have different aspirations. The second aspect related to data and research is about ensuring building trust. How can we build trust so we can collect the right data? Data, it could be quantitative, it could be qualitative, it could be about health, it could be about many other aspects of life. So ensuring trust is important, making sure that actually we as researchers, health researchers in this room, actually, and clinicians are trusted by people who share with us, their life stories or their data, making sure that there is a huge firewall between health data sets and the police or border control. That's essential to us. But of course, by building firewalls, we have difficulty to ensure continuity of data when people move from one place to another, from one country to another. That's very complicated. There are plenty of legal frameworks that prevent clinicians to share the data to another canton, another district, another province, another state. So that's that's one issue. So we discuss the possibility, and it has been tested in Saudi Arabia, has been tested during in Europe as well, when people were moving from Syria to Western Europe, about medical health passports. So people can own their data and can actually travel with their medical records. So it's another possibility. We also talked about the fact that we need to really depict in research the trajectories of people, and making sure that actually we can depict and describe where they come from, what they have experienced, and where they want to go. and their aspirations, their future, their dreams. And to do so, there are plenty of ways of doing that. We can create safe spaces. We had some examples from the UK as well. But as well, we can also make sure that clinicians and researchers are culturally sensitive to migrations and to migrants. And that comes with, there's no, what do you say, miracle about it. It has to come with training. And today we have, as we published in the Lancet last year, there are examples of discrimination and racism in health services in Europe, for example, and in many other places. So how to make sure that healthcare professionals are well trained and actually making sure that all this discrimination and racism can be eliminated. Another aspect, and it's probably my last one, amongst many other ideas shared, is about, let me try to find that, is about the narratives. We have a responsibility as researchers to change the narratives. And one way of doing that is making sure that migrants are not always described as vulnerable. Migrants are more than that. They are people who make decisions. They are a member of the family. They make decisions about their future. They make decisions about their healthcare professionals. We've got plenty of examples about that, about their jobs or many other aspects. So they have power. So how can we make sure that we as researchers in our studies, we can actually making sure that it is valued and highlighted, and that migrants can have a dignified voice and figure, and can be described as such. It goes also with all the beautiful and constructive initiatives taken by civil society organizations and healthcare professionals everywhere in the world, who actually bring this notion of solidarity. And that's needs, as researchers, we have the responsibility to document that as well. And I finish there.
Thank you very much for this summary, Carl. I'm sure there's a huge amount of food for thought here. So the next presenter for the second table, the mental health one, is Dr. Javier Zozaya. So Javier, if I may ask you to join the podium and give us a summary over again 5 minutes about what you've discussed. Thank you.
A big challenge because there are a lot of great ideas in our round table. Then my gratitude to the great participation of the round table, my colleagues, and all these inspiring moments. Mental health is clear, is essential for the general health. It's an ethical duty as human taking care of other humans. And it's very important nowadays in the integration in the new society. Our topic, how can we design migrant mental health responses that are culturally sensitive, accessible, and sustainable, was fascinating. Our group was great on ideas. Time, unfortunately, was not enough. I think we will follow to work together. Our group worked on three main questions. The first one was, what are the major barriers faced in accessing mental health support today? The second one, what ideas do we have to address these barriers? With 2 points very important: to learn about our experience, and what have you already implemented and that work, and what you have tried to do but unfortunately did not work, and why. We have to learn also about this kind of experiencing and what are the next steps. And if I can try to grab all these passionate ideas, we can organize in three main groups about the level of migrants, what we can propose, the level of professionals, what we can propose to, and about the system, what must change, and what we can do, and what we already do, what are the good ideas, the best practice. And for the migrants, it's clear, yeah, there are different cultural representations about the mental health suffering, the knowledge about psychiatry. Sometimes they have no knowledge about it. Sometimes they have other ways to try to solve the problems, and we have to count on that. The explanatory models of suffering, it's very different depending on the culture. But one of the main also problems that we can find is the trust in healthcare professionals. It's not a work for the migrants, it's a work for the professional to improve that. And in this way, for the professionals, we lack a lot of cultural humility. We need to improve knowledge about the different cultural values, how to work with passion who comes from other countries. And for the reason, there are many years ago, cross-cultural psychiatry, ethnopsychiatry was quite very well implemented in our institutions, but we thought that now we have to strengthen this knowledge about the professionals. Then the learning, teaching, the supervision of professional, it's very important to make influence about the directions, the people who have the power to decide, to be more sensitive about the importance of this kind of skills. And also, it's very important for the professionals to consider the social determinant of health. And maybe one of the most important things that in the roundtable appears, it's not only to treat the disease, but also address the experience of illness and what happens with the stigma that people feel when they suffer from mental health, how the community sometimes can be a resource, but sometimes also the community can be a problem about this stigma. And one other point also that appears very important, it's about the biases of the professionals when they work with population of other cultures. Then to be aware about our biases, about our prejudice and stereotypes, it's very important also to be sensitive. Another very important point is the lack of interprofessional collaboration. And we need to work more in network professionals in the health institutions, the very specialist about cross-cultural psychiatry, but also with the general psychiatry, with the primary care, with the community level, with the associations. And very usually professionals are only focused on the psychiatric institutions, and we have to go to the field, to go further. And for the reason also, for the system, it could be interesting to have a figure of coordinator, someone who can have an overview of all the resources in the system, not only in the mental health system, but also in the community level. And the last, but not the least, the lack of budgets. It's one fundamental problem. And sometimes it can seem something not very important, but many times we forget the interpreters, the role of interpreters, the translators, for to work with this kind of passions, and we need budgets for all these things also. And last one, to help to navigate in the system, how the system can improve the information to the migrants to be autonomous, to gain access to health. Many times there is people who has to bring them to the health system, but we have to improve the information also for the population. Then there is a lot of ideas, and I try to wrap and to organize. Then well, that's all.
Thank you very much, Javier. It's I know it's a huge task really to summarize all the discussion. The nice thing about psychiatrists always is whatever they say it in a very structured way. I like that. I like receiving letters from psychiatrists as part of my profession. They're always 2 pages, but very structured. So I like that. And then we saved the best till last. Our last coordinator of a roundtable is Jessica Fragnier, and she's the head of the Problem Management Plus. And hopefully over the next few minutes, you would be able to summarize what you've discussed with regards to co-creating care and community leadership using migrants as actors. Thank you.
So thank you very much. We had a very insightful moment. We decided to split the co-creation into 3 different questions, and people would talk about these questions. First, I would like to thank Adam, Sarah, Stephanie, and Desiree, who co-animated with me. So we're always in this which is already nice. The question we had around migration as actors were about the governance, the barriers, and the good practices. So first of all, regarding the governance, I think the major outcome of this discussion is the same for every minority. There are specificities, of course, to migration roads or migration problem or situations, let's say. But at the end, what came out of this discussion was rather to be represented in the whole process of deciding involvement from the beginning of the co-creation of the project or in the governance level. It was about listen to the voices. It was about trusting people. It was about cost efficiency, what would happen without migrants. It was about asking questions, actually, and allying with people. And I would actually resume that as what are the discussion between minorities and majorities and privilege and less privilege. Migration is not a status. Migration is just the fact that you move. And it is very important to stress that. We need to change. Carl said something very interesting about the narrative. The narrative needs to change. I hear so many colleagues saying, I have a case of, etc. In the social field, we hear that a lot. A case is not humanized. A case should not be in the narrative. It is the situation of someone with this and this and this problematics, for example. So actually the governance is actually being able to give a voice, but also being able to give a real power and a real ground for someone who has a migration situation to be able to also be part of the decision making. Regarding the barriers, we talked about bureaucracy, we talked about languages, of course, we talked about access to knowledge, and we talked about community health advocacy or many different barriers, as you know. But again, the idea is to have a peer that understands you and someone that brings you along to be able to make the migrant person as another person that has a voice and that is also impactful for the organization or for the company. The last point on good practices was co-creating program and adapt cultural leader programs. I would like to give you an example on this specific issue. As you know, I'm running, we are running, not only me, of course, PM Plus in Canton de Vaud. And we always have discussion with migrant peers and a professional about how to deliver the project that is the most culturally accessible or understandable by the beneficiaries. And we had a chart of participation for the beneficiaries who have this program, who follow this program. And we saw that there was no impact in this chart, participation chart. And we realized, discussing, that for some of the migrants, it was very important to sign this chart that would engage the migrant in the participation, or the beneficiary in the participation. For some others, it's important not to sign this chart because it engaged too much. And so it could be another solution, but we decided to have these both possibilities. Either you sign or you have an oral agreement. I say this because at the end, whatever the process, the aim is the objective. The objective is you want to reach the beneficiary, or you want to make your project happen. So you need to find ways to understand each other. And I think this came out of the good practices, which also went to involvement of the people, giving responsibilities to migrant actors, have specific guidance. I would actually wrap up saying that you need to be allies. People here in this room already have privileges. We all have privileges. I have privileges. Knowing that, I need to do something to step beyond my privilege, just to be able to help someone and give a little bit more than just saying, you're in the room, that's already enough. Because it's not enough, actually. So we need to step a little bit forward in that. And the last one I would like to add, of what I heard, it's always about one group or the other. And we talked also, or I heard terminologies like empathy. Empathy toward the other person is very important, but it has a huge bias. We're empathetic with our own group and a bit less empathetic with not our own group. So it's being able to go beyond that and be able to try to find humanity in everyone. So that's what came out as migrant as actors, is just taking people as people. Thank you.
Thank you very much, Jessica. What a personable statement to finish off with such an inspiring meeting, actually, from my point of view. I think it would be fair to put our hands together to thank all our speakers today. And then really from me to thank you so much because of the fact that you bared with us the slight delay. We still managed to finish only half an hour late, which is fine. But no, thank you so much. I hope this will be the start of something. Before you go, the last thing I want to tell you, I don't know whether it's, yeah, it is here actually. So on your way back to the foyer where you will have coffee there, either on the way to the coffee, you can stop and look at a photo gallery taken by J.J. Keith. J.J. Keith is an Oscar nominee, so you don't really get across to see the work of somebody who is at that high international level. So please look at the photos, or maybe you want to grab the copy first and then look at the photos. Well, it's entirely up to you. I leave this decision, this difficult decision, to you to make. And I think I can only thank you so much for everything, Jessica. Have I missed something? Thank you. So thank you so much, and enjoy the rest of the meeting, and safe travels to wherever you're going to go afterwards. Bye-bye.